This is Channel 2 News, coverage you can count on.
When people can't get their prescription medications, they are switching to heroin, unfortunately.
After last week's bust of an alleged prescription drug ring, law enforcement agencies and their regional partners are preparing for a potential spike in heroin use and overdoses. And that is our Channel 2 News big story at 5 o'clock. Wow. Yeah. Of course, we're talking about that federal raid at Jones West Ford and then Rand Family Care. And as a result, there were 9 arrests. We're still following this developing story. Good evening. I'm Kristen Remington.
And I'm Landon Miller. Thank you for joining us tonight. Now, with Dr. Rand behind bars, the fear is that some of his patients will actually look elsewhere for their medications, including substituting them with illegal drugs like heroin. Now, Paul Nelson joins us live in the newsroom after learning what local agencies are doing to prepare. Paul?
Yeah, Landon, the CDC says more than 28,000 people died of opioid overdoses in 2014. That's right up there with traffic fatalities. Now, half of those overdoses happened because of prescription drugs, but officials say when prescription drug use goes down, heroin use goes up. That's why police, paramedics, and hospitals are being proactive.
This allows for us to track and trend some of the paramedic responses to overdoses.
REMSA's emergency calls for potential drug overdoses were a little above average the past couple days.
There actually was a time where we were above average.
This is one of several agencies that's working jointly to prepare for and prevent drug overdoses, especially now that an alleged prescription drug ring has been taken down.
The fear would be that those people then have to turn to non-pharmaceutical grade or street-level drugs such as heroin, which is very dangerous.
Heroin is cheaper and often easier to get than prescription drugs. That's why so many agencies are teaming up.
After this recent incident, we've kind of reached out to the community to let them know some of the signs and symptoms that people may face if they do have prescription drug addiction.
While prescription drugs are controlled by the pharmaceutical companies, heroin is not and poses other threats.
You don't know what it's been cut with. We've seen that in Sacramento. We started seeing some of this being cut with fentanyl, which is 100 times stronger than morphine.
That's one reason why REMSA's taken additional steps. It recently tripled its amount of naloxone or Narcan, a reversing agent for opioids.
So this medication, when administered, will then assist with their breathing.
The CDC says nearly 80 Americans die from opioid overdoses every day, quadrupling since 1999.
We have seen in the past deaths in our area related to illicit heroin.
Along with death, Broadway says drug addiction can also lead to a spike in other crimes.
We do unfortunately have a lot of drug activity where people are resulting to robbing people, robbing businesses to try to get money to get their drugs.
Now, officials say quitting prescriptions cold turkey is also dangerous. People who do this could have flu-like symptoms, convulsions, or even die. Now, if you or someone you know is having issues with addiction, you're encouraged to call 825-HELP. Covering the big story live in the newsroom, Paul Nelson, Channel 2 News.
Interesting, Paul. Thank you. And Dr. Robert Rand appeared in court this morning. The U.S. Attorney's Office says Dr. Rand made an initial appearance before a U.S. magistrate judge in San Francisco. He was temporarily detained pending a detention hearing that is scheduled for Friday. Federal investigators say Rand, who was arrested on Friday, wrote prescription drugs without a legitimate medical purpose, which were allegedly distributed by Richard West and 7 other defendants.